Welcome to our webinar on the challenge of providing safe and accessible food for a healthy life, brought to you by CFAIR, the Council on Food, Agricultural, and Resource Economics. My name is Jane Kolodinsky, and I'm a CFAIR board member and professor at the University of Vermont. It's my pleasure to be moderating today's webinar. Next slide. It's CFAIR's mission to translate high-level research and knowledge to a diverse audience that includes policymakers, elected officials, and federal administrators. When we demonstrate the value of the profession to these groups, the Council increases public appreciation of research, extension, outreach, and academic programs in agricultural and applied economics. Next slide. Before we get started, I want to provide some background on today's topic. In late 2021, a committee appointed by the leadership of the Agricultural and Applied Economics Association developed a white paper on the grand challenge to ensure that all people have safe, affordable, accessible, and acceptable food for leading a healthy and active life. To meet this grand challenge, we need analyses that predict, identify, and explain causal relationships of policies and market conditions in the food system. CFAIR's webinar today presents an evidence base of forward and backward linkages throughout the supply chain that inform public policy to provide the forward and backward linkages through the supply chain to inform public policy to provide high quality, nutritious food that's affordable, accessible, safe, mitigates environmental degradation, and increases equity in the food system, employment, access, and health outcomes. Next slide. CFAIR has assembled a panel of experts to discuss their work, starting with Norbert Wilson, who will be providing opening remarks. Norbert Wilson is director of the World Food Policy Center. He's a professor of food economics and community at Duke Divinity School with a joint appointment in the Sanford School of Public Policy at Duke. Professor Wilson's research touches on several food issues such as access, choice, food waste, and domestic food systems. Next slide. Lin-Lin Fan is an assistant professor of agricultural economics at Pennsylvania State University. Dr. Fan's research focuses on economics of health and food. She studies how various food and health policies affect people's food choice, health, and welfare. Her findings provide important insights for current policy interventions on food access, diet quality, and food security. Next slide. Joel Cuffey is an assistant professor at Auburn University. His research seeks to examine how consumers interact with food markets and the implications of this for food and agricultural marketing, agribusiness, retail strategies, and public health. His research combines large secondary data sources with primary data collection to draw out novel insights. Next slide. Catherine Boyes is an associate professor in the Department of Agricultural and Resource Economics. Catherine conducts research on international trade, food supply chains, local food systems, and food safety issues. Her work has appeared in various journals, including the flagship journals of the Agricultural and Applied Economics Association. Next slide. Before we start, we wanted to explain how to ask questions during the webinar to make sure that you, the audience, can engage. During the webinar, you can put questions to one or all of the speakers by typing them into the box in the control display accessed by clicking on the question drop-down as shown on the slide and sending it to the organizer. Next slide. Now I'll hand the webinar over to Norbert, who will start us off.
Thank you so much, Jane. It is really a pleasure to be here with you. As the president of the Agricultural and Applied Economics Association, I am pleased to share with you the work of the AAEA. As a group of applied economists in universities, government, and industry, we work on topics that are pressing concerns to our society. We have developed a series of grand challenges that reflect the breadth of the research, teaching, and extension that we do. Members of the AAEA work on food supply chains to ensure an ample supply of affordable food for consumers when and where they want it, while assuring market access to farmers, ranchers, fishers, and food businesses. The traceable effects of climate change on crop production have already begun to occur and are likely to accumulate going forward. Thus, we are committed to analysis to support agricultural production while mitigating and adapting to climate change. As someone from rural Georgia, I am pleased that AAEA members work to enhance economic opportunities for rural residents and businesses, addressing challenges encompassing equitable rural access to business and workforce development, innovative infrastructure, and quality health resources. Lastly, and the center of our discussion today, we are committed to ensure that all people have safe, affordable, accessible, and acceptable food for leading a healthy and active life. Today, we have 3 members of our association who will share some of their work on food policies that touch on waste, alternative proteins, and supply chains. We are thrilled to share this work with you and look forward to engaging you. Back to you, Jane.
Thank you, Norbert, for your presentation. I just want to remind everyone to send questions to the organizer using the question drop-down menu. Next, we will be hearing from Lynn. Welcome, Lynn.
Thank you for having me today. I'm Lin Fan, Assistant Professor of Agriculture Economics at Penn State University. I'm excited to talk about the challenges as well as some of the solutions to providing safe and accessible food from the perspective of food waste. I'm going to discuss what food waste solutions do people support. This is based on a recent publication in the Journal of Cleaner Production with Brenna Ellison, Associate Professor from Purdue University, and Norbert Wilson from Duke University. Next slide, please. First of all, why do we care about food waste? In the US, most food waste happens at the household level. In fact, 32% of household food purchased are wasted, translating to $240 billion annual economic losses. This large amount of food waste is concerning, as the resources used to produce them and treat them are also wasted. Food waste is the single most common material landfilled and burned in the US and is the largest source of methane emissions, a more potent greenhouse gas than CO2. Related to the topic today, food waste increases food insecurity by reducing global and local food availability of food, increasing food prices, and using natural resources unsustainably. Next slide, please. To address the issue of food waste, the US Department of Agriculture and Environmental Protection Agency announced the first ever domestic goal to reduce food waste in half by 2030. Multiple food waste solutions have been proposed to cut food waste. For example, making donations easier, such as offering tax incentives for food donations, standardization of date labels, using Best Buy for food quality and Use By for food safety, feeding heat-treated and dehydrated food waste to animals, setting up community compost facilities, imposing a food waste tax for households and businesses for the amount they waste, consumer education campaigns, selling ugly but perfectly nutritious food in retail stores, restaurants offering more small options, and stores selling more package size. So the question is, what food waste solutions do people support among all those things? And is there a vote by gap? There is a growing literature examining the vote by gap, where people vote in one way but act differently. For example, people vote in favor of better conditions for animals like cage-free, but they don't buy cage-free eggs. We want to study whether there is a similar vote by gap in food waste policies, where respondents vote for one food waste solution, but do not change their behavior after food waste policy is passed. Next slide, please. So how do we analyze this problem? We send out a nationally representative survey to 1,506 adults across the US in September of 2017. We asked half of the respondents the food waste solutions they support, as people's support is more related to voting behavior, and asked the other half the food waste solutions they think will be effective, as perceived effectiveness is likely an indication of whether the respondents will reduce food waste after the policy is implemented. Next, we use factor and regression analysis to study the social demographics that support each food waste solution. Next slide, please. So what do we find? We discover that making donations easier has the largest support from respondents. 73% of respondents definitely would support making donations easier. The second on the list is the standardization of date labels. For example, using Best By for quality and Use By for food safety. Feeding food waste to animals is third on the list, where 53% of respondents definitely would support and 37% might support this solution. Next slide, please. The ranking of perceived effectiveness is also similar to that of support, but portion size now rises to the second most effective solution. Interestingly, this is in line with a number of studies that show changing portion size is one of the most effective ways to reduce food waste. Next slide. Now we measure the vote buy gap in food waste policies. This figure shows the difference between the percentage of people who definitely would support versus who think it would be very effective for each food waste policy. We find that the support rate is consistently higher than the effectiveness rate. In other words, the percentage of people who definitely would support a food waste policy is consistently higher than that of people who think the policy will be very effective. There are only two exceptions: portion size and food waste tax. Almost the same percentage of people who support and the portion size to be effective. Although tax is the least popular food waste policy, the effectiveness of this policy is much higher than the support it has. Next slide. Lastly, we analyze who support what and what are effective to whom. Our data suggests that food waste policies can be grouped into three categories: prevention policies, diversion policies, and mixed policies. Prevention policies include standardization of state labels, portion size, and package size that focus on reducing food waste ex ante. Diversion policies include making donations easier and feeding food waste to animals, which divert uneaten food for other purposes. The mixed policies include all the remaining solutions. We find age, education, geographic region, and food waste mitigation behaviors are important predictors of who support what. For example, college graduates are more supportive of all policies. Southerners are more supportive of prevention policies than Westerners. For some of the new practices in dining, using a meal kit reduces support for diversion, possibly due to less food waste left for diversion. Online grocery shopping increases support for diversion policies. The predictors for perceived effectiveness are similar as those for support. So to summarize, we find making donations easier and standardization of date labels are the two most supported food waste solutions. There is a vote buy gap in food waste policies as well, where the support rate is much higher than the effectiveness rate for each policy. We find age, education, region, and food waste mitigation behaviors affect the support and effectiveness of food waste policies. With that, that's the end of my presentation. And
thank you, Lin. Next, I'd like to turn the presentation over to Joel Cuffey. Welcome, Joel. Joel, you are muted.
Thank you. Thank you to all, and thank you to the organizers, and thank you for the reminder to unmute. I'm going to present on a project that looks at consumer adoption of a novel food product, specifically plant-based meat products, plant-based meat alternatives. This work is in collaboration with colleagues across the US. My colleagues are Lauren Cheneritas, Wenying Li, and Shuili Zhao. Next slide. I want to start by asking what plant-based meat is and why some advocate for its production and consumption. Plant-based meat is a product that uses plant-based proteins to mimic the look, feel, and taste of animal-based meat. The production of plant-based meat is generally thought to be less detrimental to the environment than animal-based meat. Specifically, the production of plant-based meat entails less greenhouse gas emissions and less water use than animal-based meat production. We often hear that plant-based diets are healthier than red meat diets, for example, but plant-based meat is less clear. The healthfulness of plant-based meat is less clear. Plant-based meat is made of plants, which would make it healthier, but is more highly processed than animal-based meat, including higher sodium content and more preservatives, which would make it less healthier. Next slide. Now I want to turn from what advocates of plant-based meat say to what consumers think about this relatively new product. First, it's important to note that plant-based meat is more expensive, which is going to limit who is able to eat this on a regular basis. Most previous studies on plant-based meat have focused on consumer preferences in laboratory or experimental settings, and they find that most customers still prefer animal-based meat. They prefer the taste and the feel of animal-based meat relative to plant-based meat. But some consumers, especially younger consumers and wealthier consumers, are or may be receptive to adopting plant-based meat. But less is known about how consumers incorporate plant-based meat into their actual diets. So in this project, we asked what the demand was for plant-based meat in real stores and among real households making decisions. Next slide. We wanted to do two things specifically. First, we wanted to characterize spending on plant-based meat and document how households spend money on plant-based meat. Second, we wanted to observe what happens when households first try plant-based meat, to see whether they kept buying it and what else changes at the time that they first try plant-based meat. We use spending data from Nielsen on over 52,000 households. Each household in our sample recorded their grocery purchases over the course of at least 3 years between 2014 and 2019. Nielsen also records socio-demographic information on these households, which we use to characterize the households. Importantly, we see exactly what products households purchase over the time that they're in our sample. We see in particular when households purchase plant-based meat and what else they purchase or don't purchase at the time that they're buying plant-based meat. Next slide. I first want to review what we found about who plant-based meat consumers are. We categorize plant-based meat consumers into 5 categories based on plant-based meat spending. Households that never bought plant-based meat, households that only once ever bought plant-based meat in the time that we observed them, and then low, medium, and high spender household on plant-based meat. We found that most households do never spend money on plant-based meat, almost 70% of our sample. And over a third of the households that ever tried plant-based meat only tried it once and never again. So 11% of our full sample. Across these 5 categories, meat spending or spending on animal-based meat did not change very much, meaning that households spend money on plant-based meat no matter how much they spend also on, households spend on animal-based meat no matter how much they spend on plant-based meat. Similar to previous studies, we found that plant-based meat consumers are younger and more affluent and more educated than other consumers. Next slide. Next, we wanted to see what happens when a household first tries plant-based meat. In the figure to the left, I show the monthly spending on plant-based meat in the months before, negative months, and after, positive months, a household first tries plant-based meat, month 0. When consumers first try plant-based meat, they spend almost $8 in that month on plant-based meat. However, in the months after trying plant-based meat, spending on plant-based meat falls by 75%. We also used similar graphs to see how spending on other food products changed at the time that households first tried plant-based meat. Importantly, we find that spending on animal-based meat doesn't change at all when households first try plant-based meat. Instead, spending on deli products, such as deli meats, drops, but only over the short term, and deli meat purchases or deli product purchases jump back to normal in months 1 and onwards. Next slide. I want to end by emphasizing or noting that plant-based meat has enjoyed some recent growth, and some of that growth is not going to be captured in our data, which ended in 2019. However, as of 2019, plant-based meat was not leading consumers to substitute away from animal-based meat. This was true both for first triers of plant-based meat and also for more established plant-based meat customers. On the whole then, consumers were not incorporating plant-based meat into their diets on a regular basis. Instead, the price, taste, and habits of animal-based meat consumption has continued to limit plant-based meat demand. Thank you. Next slide.
Thank you, Joel. And finally, I'd like to welcome our last speaker, Catherine Boyd. You're muted.
There we go. Wonderful. Good afternoon, everyone, or good morning, depending upon where you're located. My name is Catherine Boys, and I'm an associate professor in the Department of Agricultural and Resource Economics at North Carolina State University. For today's webinar, I will be touching upon a number of issues that largely complement the nutrition story, but are largely focused, though, on food safety. Next slide. Indeed, here's just a few of the many headlines that we've seen over the past year addressing various issues concerning food safety. Almost daily that you'll find something in the news concerning various bacterial problems, various supply chain issues that have compromised the safety of foods, contamination through physical items such as plastic or staples, metals, etc. leaving us as consumers perhaps overwhelmed and with the amount of information that there is concerning the risks to do with related to our foods. So I thought today we'd focus a little bit first on what food safety is. Next slide. And importantly, what it isn't. And so this is a handy graphic that this was developed by the Global Food Safety Initiative. Here we can see the difference between food safety and some related concepts. Food safety, you'll see here reflected in the lower circle. This is food that is not fully safe, maybe not horrible, but not fully safe for human consumption. Importantly, that's different from a food quality problem, wherein we might have food that's still consumable, but may offer less nutrition or be less visually appealing. In both of these cases for food safety and quality issues, this is unintentional, accidental, just regular, potentially supply chain problems. However, you'll see at the other side of this figure, where instances in which we have intentional problems that are introduced into our food system. Importantly, food fraud is related and as you can see, overlaps with the concepts of food safety and quality. This is a case where we are looking at individuals or companies that might have an economic motivation, an opportunity to financially gain from producing and distributing a fraudulent food. Also, there is a whole other realm of study and indeed government programs and policies related to the idea of food defense, wherein someone might have an ideological drive to try to harm individuals through food systems. In this case today, we'll be focusing mostly on food safety in a general sense, but also looking a little bit at food fraud, as I'll explain in a moment. Okay, next slide. So why is this important? Well, the economic cost of this and the burden for public health really cannot be overstated. In the US, the CDC estimates that there is about an annual cost of about $78 billion per year due to foodborne illness. This is due costs derived from loss of worker absenteeism, lower work productivity, as well as, of course, explicit costs through healthcare and other medical costs. Each year, a large number of us will experience foodborne illness. Indeed, about 1 in 6 of us will become sick in some way from our food. A lot of this, though, is not reported. We will self-treat at home, but the more severe cases, of course, will require medical intervention, and unfortunately, in about 3,000 cases per year, do result in death. We know as well that those that have compromised immune systems or are pregnant, elderly, and certainly unborn are particularly at risk for foodborne illness. And finally, again, a lot of our illness can occur through a variety of settings, but restaurants do tend to be the most likely setting in which you'll consume foods that may make you ill. Next slide. So I very much appreciate the opportunity today through this webinar to focus on both food safety and nutritional linkages, as very often these issues are treated quite separately. Food safety and nutrition, though, of course, are inextricably linked. To achieve optimal health, we, of course, need individuals who are both well-nourished as well as free from disease. And so with that in mind, I thought we'd just take a few moments to highlight some of the contemporary issues that are really at this nexus between food safety and nutrition. First, we'll talk a little bit about individual food safety concerns. I do want to address food fraud and some of the patterns and trends we're seeing in that, as well as a new, I won't say newly emerging, but newly recognized or more recently recognized issue concerning climate change and food safety. Next slide. So first, looking at individual food safety, it's important to note, of course, that what is safe for some is not safe for all. We've got certainly food allergens that are one of the fastest growing health concerns in the United States. Recent estimates have found that about 32 million Americans, approximately 1 in 10 of us, are affected with some degree of food allergy. Again, it might not be terribly severe, but certainly in some instances, it can have very serious health consequences. Cumulatively, this has been estimated to have an economic burden of about $25 billion. Overall, this is a very much overlooked diet-related disease, which can be addressed through consuming appropriate allergen-free foods. In addition to those that have allergens, there's a large number of our population that have special dietary needs. Individuals with osteoporosis, heart disease, and stroke, as well as type 2 diabetes, among other ailments, certainly can have their medical conditions improved or are further worsened through not having appropriate diets. Of course, though, this is complicated through food price and inflation. So we've seen, and there's been a number of studies in the last few years that have looked at this price inflation. Certainly, though, the cost of special needs foods, those that do meet the allergen-free requirements of some consumers or the special dietary needs of others, have increased proportionally, or indeed at higher rates than our average food inflation. Important to note as well that those with food allergies and special dietary needs are more likely to be those that are of lower income status and who are more are more food insecure. These individuals are more likely to rely on social support programs, which themselves may not always provide enough funding to buy nutritious diets, let alone diets that do require higher cost foods. So this is certainly an issue of concern, especially again in a period where we have food price inflation. Next slide. I wanted also to introduce the idea and to discuss a little bit about food fraud. And so this might be a newer concept for some, so I think a quick introduction to food fraud. There are many types. The most common that we see is adulteration, wherein some component of a finished food product is fraudulent. So maybe an ingredient isn't what it claims to be on a food label. There is, though, tampering, overrun, certainly a lot of food theft, wherein tractor trailers are effectively stolen and that food redistributed through standard food systems. There's diversion, and lastly, counterfeit, wherein we might have a product that looks legitimate. The packaging indeed might be legitimate packaging, but the actual contents are not what they claim to be. The Global Food Safety Initiative and global food industry estimates that there are losses of $30 to $40 billion a year due to food fraud. So again, it's not an issue we hear about, but certainly is economically very important to this industry. Indeed, a single incident food fraud can cost a company anywhere from 2 to 5% of its annual revenue, according to estimates from a few years ago from the Grocery Manufacturers Association. Next slide. Particularly relevant to today's conversation, though, are the public health consequences of food fraud. And so products that do not offer the level or type of nutrition promised by the product can certainly have health consequences. Think for a moment of infant formula or nutritional drinks for seniors or children, where they're relying on the nutrition in that product as a primary source of various parts of their diet. Importantly, too, foods can become adulterated or made with toxic substances. We see a number of bulking agents, for example, added to spices, wherein a cheap filler such as peanut shells can be grated, added into a regular spice, and bulk the spice up and really reduce the price from a cost perspective to the producer, but not change the price from a consumer perspective. So that's a very common one. We also see lead-bearing pigments and other unapproved color additives being added to spices to, again, increase the price and consumer willingness to pay for what looks like a very potent spice or a very fresh spice. Products can also be adulterated with allergenic substances. Indeed, if those peanut shells that are added are given or consumed by someone with a peanut allergy, obviously there can be important health consequences to that, as well as in instances where fraudulent foods are stolen and redistributed. They may not be handled in the way in terms of temperature control, for example, that is needed, and in these cases can become unsafe. There's also a number of instances we heard from our first speaker about date labeling and such, and in this case, there are many instances where products are relabeled in terms of changing the best before dates on items. Okay, next slide. So very briefly, I just want to highlight a few trends we're finding with regard to food fraud. So this is using a Horizon Scan data set, which we can discuss more if there's interest. We've been looking at cases of food fraud over the last 2 decades. You'll notice, again, fairly low levels. Part of this is this is an underreported type of crime, but indeed, so there's partly these trends are due to improved reporting, but also just some case increases. As we see, in particular during COVID, there was indeed a larger opportunity for food fraud. There was disrupted inspections, a variety of shutdowns, additional en route shipping times that led to more time and opportunity for foods to be stolen and diverted. Next slide, please. Okay, this is not just a global problem. I do want to highlight through this information here that indeed the US has plenty of its own cases of food fraud. The difference between the US and many other countries is a lot of these cases are though found and notified to buyers by the companies themselves. And so they don't always hit the marketplace. You'll notice though that in the lines in blue are instances wherein other countries were the ones making the US or US firms aware that their product had been, there was a fraudulent version of their product on the market. So with regard to the US story, that there is a lot of meat products. You can see meat and seafood preparations, as well as fresh meat products, seafood, as well as other processed foods, coffees, teas, etc., that we're finding fraud cases in. Next slide, and next slide. So I just want to wrap up, and the next slide. Very briefly, to just introduce some of the newer research, and again, colleagues in other disciplines are hard at work at this. I think from a sort of an economic and business perspective, we're newer to start thinking about some of the linkages between climate change and food safety and nutrition. And so this is a really handy infographic from a large report that was released last year, or in 2021 rather, from the US Global Change Resource Program, wherein there's an increased recognition of some of these linkages. So for example, in cases where we're finding higher temperatures and increased precipitation extremes, this can increase the pathogen load in our soils. This can affect the use then of our pesticides to control some of the weeds and fungal populations that are coming out or are evolving through those changes in soil and climate conditions. This also, though, impacts the uptake of or the nutritional content of foods, as well as it can impact food spoilage both in field as well as the decreased processing times. And finally, this obviously can also impact food distribution when we've got cases of extreme flooding, for example. So with that, I'll end for today, but looking forward to the upcoming conversation.
And before we wrap up, we encourage those of you who enjoyed this webinar to sign up for our newsletter, where you will get more information on similar events online at cfare.org. That's CFARE.org. A recording of this webinar will also be made available on our website and on our YouTube channel in the coming week. We also have a podcast series, Get a Grip on FAIR, available on our website, Spotify, Apple Podcasts, or by visiting rss.com/podcast/keeping up with FAIR. And you can also find it by searching our name. That's the Council on Food, Agricultural, and Resource Economics on any platform. And last but not least, please follow us on Twitter for regular updates at CFARECon. That's CFARECON. We encourage any and all inquiries. Next slide. A quick word of thanks to our partners. This and other CFAIR programming wouldn't be possible without the continuing support of the Agricultural and Applied Economics Association, that's AAEA, the Department of Agriculture's National Agricultural Statistics Service, that's NASS, as well as the USDA Economics Research Service, and that's ERS. And we want to give a big thank to you, our panelists. We want to also thank you, the audience. We're passionate about these subjects, and we think you are too, but it's not a small thing to plan to give up an hour of your time to spend it with us. We hope you've enjoyed this event as much as we've enjoyed hosting it. Thanks so much, and we'll be back in early fall. Thanks, everyone.
Thank you.